and I serve. Hi, everyone. Good morning. My name is Xiomara Peña, and I serve as the Vice President of Community Engagement and Innovation here at HOPE, Hispanas Organized for Political Equality. It is an honor to welcome you to today's media briefing on maternal and birthing health equity. The issue is deeply personal to our communities, and we are proud to be here with our partners, BWOPA-TILE and Avidoris, to unveil research that shines a light on the experiences of Latinas and Black women across California. We hope today's discussion will help spark the kind of policy changes that ensures that every woman, every mother, receives the care and dignity she deserves. Now, before we dive in, just a quick overview of what to expect during today's call. We'll begin with opening remarks from our organization's principals, followed by a presentation from the lead researchers behind the report. We'll then hear insights and reactions from maternal health practitioners who served as advisors on the project. And finally, we'll open it up to questions from the media. Please feel free to unmute yourself during the Q&A or drop the questions that you may have into the chat at any time. Now, it is my pleasure to introduce two women whose leadership and partnership have made this research possible. Helen Iris Torres, Chief Executive Officer of HOPE, and Lanice Jones, State Executive Director of BWOPA-TILE. Helen and Lanice, the floor is yours.
Thank you so much, Xiomara. It's an honor to be with all of you this morning as we spotlight an issue that's directly impacting the well-being of our communities, maternal and birthing health equity. Latinas and Black women continue to face disparities in their experiences with the healthcare system, disparities that are often shaped by structural inequalities, lack of access, and systematic biases or discrimination. These aren't just policy issues, they're personal, affecting families across California every single day. At HOPE, we approach this issue through the lens of health access and quality of care. Ensuring Latinas have information, access, and quality care they need is a vital part of our mission to advance economic and political parity. This project is a powerful example of what can happen when we listen and center the voices of those most impacted and back those stories with rigorous research and community-informed insights. In short, listen to women. I want to extend a sincere thank you to Kaiser Permanente, whose support made this report possible. Their 3-year investment is allowing us to examine the healthcare inequalities experiences of Latinas and Black women across California, and to elevate solutions that can lead to lasting change. Together with our amazing partners at BWOPA-TILE and Avidoris, we are proud to share this research and continuing pushing for health systems that are more equitable and more just and more responsive to the needs of communities. Thank you, and I'll turn it over to our dear friend and amazing leader, Lanice.
Good morning, and thank you, Helen. Thank you for joining us all today for this important conversation. As the State Executive Director of Black Women Organized for Political Action and the Training Institute for Leadership Enrichment, I'm so proud to stand alongside our partners, HOPE and Avidoris, in advancing this important, vital maternal health research. Black women and all women of color deserve to be seen, heard, and prioritized in the policy decisions that impact our reproductive and maternal health outcomes. This research helps illuminate the lived realities our communities have known for generations and provides the data we need to drive transformational change. At BWOPA, we believe that political power and public policy must be shaped by those most affected. Today's briefing is not just about the data. It's about the lives, voices, and leadership of women committed to dismantling disparities in maternal health care. Together, we are holding systems accountable and pushing for care, dignity, and justice that our communities deserve. Thank you. And now I'll turn it over to our partner, Eviderist, Dr. Shakari Byerly.
Good morning, and thank you so much to HOPE and BWOPA for this important opportunity to present the results of a consequential and groundbreaking report on the experiences and priorities of Black women and Latinas across the state of California. I also want to acknowledge Eviderist CEO and President Rodrigo Byerly and our president, Raquel Beltran. Angela and I would also like to thank our staff, polling analyst Shiran Wang, associate researcher Caden Sheps, and associate data analyst Presley Moreno for their important work and contributions in executing this research. On the next slide, you'll see an overview of the work that we've conducted. The 2025 California Equity and Maternal Health Report is based on research among Black women and Latinas across California on issues related to childbearing, maternal health, and approaches to creating a more equitable birthing system in California. The study included 2 online focus groups, one among Latinas and another among Black women who either were pregnant or who had given birth. I think in a moment we should be able to allow sharing so that you'll see the presentation of both the overview and the survey methodology. And research associate Caden Sheps will be sharing that presentation once he receives access. The focus groups were conducted between September 19th and September 24th of last year. The report also highlights, and we'll be covering today, results from the quantitative research, which was a survey of 800 women and birthing people, documenting their experiences and priorities for expanding access in California's maternal health system, and also addressing maternal health disparities. Taken together, this report reveals significant gaps in maternal health in the state and a system of maternal health that Black women and Latinas feel does not squarely center their needs and priorities. On the next slide, once it's available, you will see additional information about the survey methodology. And I'll pause here to make sure that we have the slides being shared.
Hi, Dr.
If we could
Shakari.
advance to
We were able to bring some slides up. I think we've got it.
wonderful. Thank you so much. If we could advance to slide 3, you'll see a bit more about the survey methodology in particular. So we spoke specifically to women between the ages of 18 to 49 who identified as either Black, African American, and or Hispanic and Latina. The research was conducted in late November to early December, and we had a dual frame sampling approach. The data that you'll be reviewing today was weighted to match distribution of California Black women and Latinas by age, level of educational attainment, region, and insurance status. The percentages may not sum precisely to 100 due to rounding and the weighting. With that, I'd now like to turn it over to my colleague, Dr. Angela Ocampo, to take us through an introduction to the report and key findings.
Thank you, Dr. Byerly. Okay, so let me begin by talking a little bit about how to understand the findings that we will overview in just a moment, so we could move on to the next slide. I do want to point out here how important it is to consider the fact that Black women and Latinas are disproportionately impacted by the maternal health crisis. Both Black women and Latinas face heightened risks during and after giving birth, including higher death rates. Of course, this is much greater for Black women. It impacts them in a larger way. So in 2022, the national mortality rate rose to 19 maternal deaths per 100 live births, and this rate was 50 deaths for Black women, 17 deaths for Latinas, and 19 deaths for non-Hispanic white women. Also, Black women and Latinas face a greater risk of complications during childbirth, ranging from a variety of different indices of preeclampsia, hypertension, among others. It is the case as well that the risk of postpartum depression is 80% greater for Black women and 40% greater for Latinas. In addition to this, it is important to underscore the role that social determinants such as poverty, coverage of insurance, environmental factors, and others disproportionately and negatively impact Black women and Latinas. Next slide, please. And as we consider the current status of Black women and Latinas, it is also important to note how Black women and Latinas have been historically underserved and subjected to medical harm. So understanding their current access to maternal health, we have to talk about the great deal of disparities and inequities that stem from long historical legacies of discrimination, racism, and racial and ethnic-based medical harm. We know that much of the foundational work in medicine in obstetrics and gynecology was built on the experience of enslaved Black women. And we also know that dating back to at least 1907, eugenics boards and other state-sanctioned programs disproportionately and explicitly targeted Latinas, with California actually being one of the leaders in the nation in these sorts of practices. Most recently, we have also seen formal complaints against Immigration Customs Enforcement detention centers for denial of medical care and potentially forcing hysterectomies upon Latina immigrants. So now let me move on to our first set of key findings and the next slide. Our first set of findings is that 1 in 4 Black women and Latinas find it difficult to access obstetric and gynecological care. It is also the case that along this pretty notable rate at which they found a difficulty in accessing this type of care also comes difficulty in accessing all other types of help for even things like routine health care. Next slide. So 1 in 3 women in our study found it very easy to access care, but also a notable percentage of them found it really hard or found a limited access to that. So both Black and Latina women in our study, about 32% of them had a total difficulty in having access or finding access to doctor or other healthcare providers for non-emergency or routine healthcare. And as I mentioned just a moment ago, this goes hand in hand with the challenges that they also face in the difficulties that they have in finding care for OBGYN and gynecological care, as well as prenatal care. In addition to that, our research finds that there is also particularly limited access to postpartum care, including family paid leave and access to doula and midwife services. So we found that a pretty sizable 47% of Black women and Latinas in our study reported a total level of difficulty accessing paid family leave after the birth of a child, at 36%. Finding total difficulty with accessing doula or midwife services, and 34% with regards to postpartum care and after the birth of a child.
I'll now take us through our second finding, actually one of the most striking. Nearly half of Black women and Latina birthing people a full 46% report some level of unfair or adverse treatment, either during pregnancy or during their birthing experience. This is the case even though California hospitals are required to provide written instructions on how to file a complaint for patients that experience racism, discrimination, or unfair treatment. A majority of Black women and Latinos also say they do not know how to file a complaint. You'll see the specific findings on the next slide. We asked, thinking about your experiences during pregnancy and or labor and delivery, have you ever been treated poorly by a doctor, a nurse, or any other maternal care provider because of characteristics like age, your race or your ethnicity, your ability or assumptions about your ability to speak English, your body type, your age. And what we find is overall 46% say they have experienced some form of poor treatment. It's important to note that nearly 2 in 5 say that they have not experienced such treatment. But the striking finding here is 3 out of 5, 59%, don't know how to file a complaint if they were to experience such instances. On the next slide, you'll see some additional information about the specific types of experiences that women have had. Nearly 1 in 4 report having a healthcare provider who is not supportive or responsive of their needs. That's the first item, with 36% reporting yes, they have indeed had that experience. 34%, a third, say their symptoms were not taken seriously by a maternal health care provider, or that their wishes or preferences were not respected during labor and delivery or at some other point during their prenatal or postpartum care. That's just over 1 in 4, or 28%. I'll pass it back to Dr. Ocampo, who will take us through the next finding from the research.
Our next set of findings pertains to the level of confidence or trust that Black women and Latinas have with regards to the systems in place to support women and birthing people. It was striking for us to find in this research that Black women and Latinas express low levels of confidence in these systems in place to support them and birthing people while they're pregnant or giving birth. 58% say that they either don't know how often they can trust California's birthing health systems, or that these systems can never be trusted or only trusted some of the time. We still find a majority of the women do trust nurses, and a near majority, 50%, trust obstetricians and gynecologists. So let me walk through these set of findings in a bit more depth with the next slide. So again, here we find that less than a third trust in the healthcare system overall, right? And as you can all see, it's pretty striking. 67% of them say that when we ask them, thinking about how things are in California right now, how much of the time do you think you can trust the following? And when we ask them about the healthcare system in general in California, 67% said none of the time or only some of the time. With comparison to some of the other systems in place, Medi-Cal, also other systems in place to support women and birthing people, and even private health insurances. Over a majority of Black women and Latinas in our study report that they trusted none of the time or only some of the time. In our next slide, the findings with pertaining to trust of OBGYNs and nurses tell us an interesting story as well. So when we ask women about how much of the time they could trust doulas and midwives, OBGYNs, nurses, and doctors in general, we see that there is a greater mistrust or lower levels of trust of doctors in general. We see that 60% of Black women and Latina report trusting doctors only some of the time or almost none of the time, compared to the percentages that they report trusting doulas and midwives, these percentages are much greater. A majority of the women do trust OBGYNs, gynecologists, and other doctors who specialize in women's reproductive health at 50%. And this is even slighter for the trust that women have all or most of the time in nurses at 53%. And now we just to kind of hear from some of the women in our study. So the next slide shows us in their own words how women felt and sought a greater desire for a healthcare system that actually centered and supported them and empowered them as birthing people. So one of our Latina focus group participants, a 24-year-old from the Inland Empire, reported saying that a good system would show that they care more than just passing the women along and getting them in and out of the appointment and also in and out of the labor and delivery rooms. Many of the women discuss about how they felt that things were pushed onto them, things like C-sections and other things to speed things up, as they reported in their own words, rather than let it be whatever the women actually wanted it to be. So this woman says the doc rather let alone my own experience, that the doctors and the systems that are in place are not for the well-being of the parents and the babies. It's just kind of to get numbers in and out of the rooms that we're going to be in for whichever stage of the pregnancy it is.
Importantly, our fourth finding really uplifts that the perceptions and the experiences in California's maternal health care system tend to restrict what women see and birthing people see as the realm of possibility. 3/4 of Black women and Latinas report that economic insecurity and the impact of childbearing on their health do factor into their decisions about whether or not to even have a child. On the next slide, you'll see these findings in greater detail. We asked specifically, at any time, have any of the following been a part of your thinking or decision-making about whether or not to have a child or to have more children? Socioeconomic factors, concerns about their well-being, and access to childcare and quality care are important considerations. For each of the items on this slide, we have 68% or more who indicate that this has been a consideration for them. Income, the potential impact of childbearing on their health and well-being, access to affordable housing or a place to live, access to affordable healthcare coverage, access to affordable childcare, and the quality of care that they might receive while pregnant or giving birth. On the next slide, you'll see some of the additional items that we presented to women. And I'll draw your attention really to the fourth item down. 59% or 3 out of 5 women say that statistics related to maternal health disparities, racism, or discrimination in healthcare settings was a factor in whether or not they considered to have a child or to have more children. Dr. Campo will now take us through our fifth and final finding.
So for our last set of findings, the research showed that a majority of Black women and Latinas reported experiencing depression, anxiety during pregnancy or postpartum, and many, almost nearing a majority, reported not receiving or not recalling receiving mental health screening as part of their prenatal care or their postpartum care. So to look at those numbers in more detail, we can go on to the next slide. When we asked women if they had any of the conditions that we listed during pregnancy or childbirth, 57% of them reported experiencing depression, 55% anxiety, 43% postpartum mood or anxiety disorders. And then when we followed up and asked the women if they had received or recalled experiencing some of this care, only 19% of the women reported experiencing mental health screening during the pregnancy, 14% both of the times. But a very sizable, as I mentioned, almost near majority of the women at 46% reported not receiving any mental health screening or recalling receiving it, either during or after pregnancy, giving birth. So with this in mind, I would like to now move on to our key considerations and conclusions. from the research. First, Black women and Latinas see economic support as intricately tied to maternal health equity. Black women and Latinas say that having income and having enough resources to be able to raise a child greatly impacts the decision that they're making about whether or not to have a child or to have more children. So it's important to consider how access to resources and access to income is intricately tied to maternal health. Of course, affordable health insurance is also important, as well as stable housing, food assistance, accessible and affordable childcare, and their ability to take time off work, paid family leave, among others, rank as important supports amongst the women in our research. The second conclusion is that concerns about mental health and quality care and access are also key areas of focus. The majority of Black women and Latinas in our study reported experiencing a great level of depression and or anxiety during pregnancy or postpartum, and many don't recall if they received any mental health care screening. Nearly half of the women report experiences with mistreatment by a maternal care provider, and nearly 3 in 5 do not know where or how to file a complaint. Nearly 1/3 of the women report having difficulty finding a provider for routine healthcare, not just maternal healthcare, but any kind of routine healthcare. So this is quite notable. And then lastly, more than half of the women in our study report that the quality of care they receive while pregnant or while giving birth was a key consideration in their ultimate decision about whether or not to have children or more children.
Finally, the policy implications of this work. The findings really highlight the need for holistic care and expanded access to alternative maternal health services. A significant majority, more than 3/4, support expanding access to these types of alternative approaches to prenatal, labor and delivery, and postpartum care. And that includes doula and midwife services, information about healthy and nutritious foods, for example. Despite the presence of laws that are aimed at addressing healthcare disparities in California, these findings really indicate inconsistent implementation, limiting their impact. Stronger efforts are really needed to ensure fidelity to existing legislation. Respondents also emphasized the need for comprehensive economic support, with 74% identifying expanded access to paid family leave as an extremely high priority. Many also cited time off work, childcare assistance, food or financial assistance, and stable housing as critical to positive health pregnancy experiences. Finally, while shared identity factors such as gender, race, or religion ranked lower in importance than some of the other items in the study, a solid majority support increasing the number of Black and Hispanic women in birthing care professions. Additionally, a majority of respondents identify that respect is extremely important to provider quality. I'd like to thank you for your time and attention, and we pass it back to Xiomara and the HOPE BWOPA team to lead us through our Q&A.
Thank you so much, Dr. Byerly and Dr. Ocampo, for walking us through these very powerful findings. And to the entire Eviderus team for your exceptional partnership and your deep commitment to equity in research. I will just say that as part of having served as part of Governor Newsom's Paid Family Leave Task Force, the data presented here really does confirm the importance of building equitable systems across the state of California. And as we close our conversation, we're honored to hear from two of our esteemed project advisors, both of whom bring a wealth of expertise and lived experience to this work. We were lucky enough to have engaged over 4 phenomenal leaders in the space, and to hear from two of those doctors is really special. So first, we'll hear from Dr. Venice Curry, a medical doctor, trained psychiatrist, and board member of the Black Wellness and Prosperity Center based in the Central Valley. And then we'll hear from Dr. Diana Ceballos Robles, a board-certified OBGYN and maternal fetal medicine specialist at Kaiser Permanente, where she provides care to patients in Oakland and Richmond, California. We're incredibly grateful for their leadership and partnership in shaping this project and for their continued advocacy on behalf of women and families across our state. Dr. Curry, Dr. Ceballos Robles, thank you both for being here with us today. I'm turning the mic over first to Dr. Curry.
Thank you so much. And it's really a pleasure to be with all of you. I want to thank BWOPA and also thank HOPE for this opportunity, and really just to thank you all for this excellent work. As you've noticed and as you've identified, this is not just a set of numbers. It is very personal, and it does have to do with the health and well-being of our community, but also individuals that we know and love. And so it is deeply personal and very impactful. There are some areas that I think are really interesting in this study that I'll just take a minute to point out. One is that although there was a lack of information around doulas and midwives, their level of trust, as expressed by the participants, was very high. I see that as an opportunity not only to share information, but also to build on the excellent work that has already been done. And I want to just shout out Black Wellness and Prosperity Center for the doula training and all of the work in preparing doulas to be those trusted messengers. Clearly, the work is paid off, and it's an opportunity for us to continue to grow that space and to provide really excellent care for moms. So I see that as a real opportunity. The other area that I see is the issues of folks wanting to know more about how to live in a nutritious, how to have access to nutrition, to better exercise, and really to think about the environments, both personal environments and built environments that can really support healthy pregnancies. And so I see these as areas where we can continue to grow the information, share the information, and provide really solid data about the ways that women can advocate for themselves, because clearly they are willing to do that, they are interested in doing that, and they see that as a real benefit. Some of the areas of concern are really the lack of trust that was expressed around just routine doctors, those that were not specializing in women's care, but were not seen or held in as high esteem. And so the concerning thing is whether or not, if you're not trusting them, if there are reasons not to trust them, how do we repair that, but also make sure that there is a level of quality of care and standard of care that helps to improve that trust and also improve birth outcomes. So areas for definite repair, definite ways to access those folks who can be more supportive, but also to really examine the reasons why there is that lack of trust. And is that an area, again, for growth and opportunity? And then finally, the issue of quality of care always seems to come up, and whether or not it manifests as people's experience of disrespectful care or non-attention to what people are complaining of or concerned about. It seems that we are still needing to figure out ways to address the implementation of existing laws, but also to uphold what physicians consider the standard of care and how it is implemented in such a way that women are heard, their needs are attended to appropriately, and their sense of dignity and respect is maintained, such that the birth outcomes, not only for infants, but for maternal care, is improved. And so I see a number of different areas where we can provide education and information, but also to think about the policy implications and how do we increase the level of accountability. Part of that I heard from their solution was increase the number of African-American and Latino physicians. And I certainly support that as a recruitment tool And I think that there are movements and actions going on in the state of California to help with that, but it won't be successful without our voices. So again, I want to thank you for the opportunity and really thank you to the team for such excellent work. Thank you.
I echo Dr. Curry's points. I'll try not to actually repeat anything because I wholeheartedly agree with a lot of my takeaways as a obstetrician in maternal fetal medicine. I also want to just voice again, big thanks for the opportunity to participate in this work and participate today, and to have the opportunity to learn from this work in a clinic and take that back to clinical environments and educational environments is a true privilege. To add to some of the points that Dr. Curry highlighted, I think a key takeaway for me and my clinical role was to highlight how this work emphasized that the solution, our community has a sense of solutions, that solutions will work for them. Frequently in institutions of higher learning and also clinical spaces, our eagerness to help can overlap with the fact that these solutions can come from community members, and that if we pause to listen to the voices of our patients, that those solutions can really be more accessible. And so that, I think, it's a privilege to have access to some of these thoughts that we all as members of the community can really connect with as well. Respondents voiced strong support, as Dr. Curry highlighted, for increasing diversity in the healthcare workforce and across different aspects of the healthcare workforce. And there are current political voices that may make those programs very much in jeopardy. And California has historically spearheaded a lot of programs and funding opportunities to really maintain diversity initiatives. And our community cares about that. Our community sees that as a solution to close the gap in health inequities. And those voices are going to be very powerful to maintain these programs and to maintain funding at universities and in the nonprofit sector. And these are things that we can continue to elevate and emphasize that this is something that our citizens really, really need and want. A big takeaway for me as well that I want to elevate in clinical environments is how respondents voiced that desire, not only to just have more information and access to midwifery and doula services, but to also promote them and get more providers. There's a lot of work across the state, also spearheaded by the California Healthcare Foundation, emphasizing how midwifery and doula services could really help to close the gap in health disparities in maternal care, and particularly with some of the challenges of maternal care deserts in California and throughout the country. I completed my OBGYN residency and maternal fetal medicine training at the University of California in San Francisco, and a major part of my education in those programs was spearheaded by the midwifery faculty at UCSF. Both at UCSF Mission Bay and the Zuckerberg San Francisco General Hospital. And they are experts in physiologic birth, and they really supported my development into becoming an expert in complex and high-risk obstetrics. And that opportunity to learn and train with them, I think, has made me a better physician, and has made me a better physician not only as an educator and collaborator with my colleagues, but also with my patients. So even as I am not a midwifery provider, but I have benefited from midwifery support and midwifery leadership. So that's something that it's clear that the community can also benefit from that, and help making sure that we are supporting midwifery training programs and doula programs to increase our access across the board for them. I have the privilege now of working at Kaiser Permanente, and have the privilege to continue working with midwifery colleagues who also spearhead perinatal care, group prenatal care, and residency education. In addition to that, I just wanted to really highlight the importance of the collaboration of this work with not only really centering community voices, but giving an opportunity for clinicians to really take this into our spaces. And I think that ultimately, hopefully, will be a step towards the challenges of trust and the challenges of that connection, and to really seed that first voice to our community and continue to serve them, because we all come to this work with the hope of improving perinatal care and making sure that everyone has the positive and dignified experience of their pregnancy and postpartum experience.
Thank you, Dr. Ceballos Robles. Thank you, Dr. Curry, for your thoughtful reflections, for the critical work you do every day, really to advance health equity in our communities. We really appreciate your partnership and your insights. Now we'll open it up for questions from members of the media to any of our speakers. Feel free to raise your hand and unmute yourself, or drop your question in the chat, and we'll do our best to get to as many questions as possible. So I do see a question that has popped up here while folks are still figuring out if we're going to have additional questions. But one question that we have is, why was it important for your organization to be part of this collaborative effort? And I think I want to invite Lanice and Helen maybe to share a quick remark. Lanice?
Here I am. Hello. Now, to restate the question a little bit, one more time.
Sure, absolutely.
Why was it important for us to work together?
Why was it important for your organization, from your perspective, to connect on this research project?
It definitely is important. We are continuing to build our partnership. We started out in working on mental health, and then now we're working on maternal health. And in particular with our target audience of Black women and Latinas. And what is important is about equity. We need to ensure that we are sharing the voices of those who perhaps have not had the opportunity to be in the forefront. So it is important, as I say, we are sisters keepers, and that we want to be able to empower our community, as well as help them to, share their voices, so that the systems that are not necessarily benefiting them at this time, they are aware, and we're able to come up with solutions, so we have that transformational change. So this partnership allows us as statewide organizations to have a further reach, and more powerful reach, in providing those solutions.
Thank you, Lanice. Thank you so much. I think this is a really meaningful, important work, and the data shows how critical it is. I also see a question for our researchers here in the chat from Libby. I think we got a question here. How I am also hoping to hear more context on this stat. Around 47% reporting difficulty accessing or no access to a paid family leave for the birth of a child. Can we maybe spend some time talking about that question in the research?
Absolutely. Happy to share some information from the crosstabs. We know that this issue is a particular barrier for lower income women. So for example, birthing people and women on Medi-Cal reported, not surprisingly, lower access to paid family leave for the birth of a child, 51% to be exact. This is also a more significant barrier for Latinas than reported by Black women. 53% of Latinas report this as a barrier. The barrier is consistent statewide, but particularly high in our urban areas. So Los Angeles, 48% of women report this as a barrier. In the Bay Area, that number is 47%, and in the Central Valley, it's 51%. It really underscores the importance of economic supports for the ability of women to have healthy birthing experiences, to have the time that they need to heal and recover after birth and in the postpartum period.
Wonderful. Well, receive notice that we are here at time. I know there might still be outstanding questions that we didn't get to, but know that we are committed to trying to get those questions answered. And so feel free to reach out to us. We have folks that are able to be interviewed and share more context as to this data. And this has been important information to get out, and we so appreciate you taking time on a Thursday morning to join us and hearing some of our key findings, potential recommendations, and just a path forward as we think about building an equitable maternal health system that works for all. And so with that, thank you for joining. This concludes our maternal health media briefing.